Okay, good. Is everybody ready? Good. Good afternoon. Thank you all for being here. I'm Dr. Larry Antonucci, President and CEO of Lee Health, and we really appreciate you being here with us. This is a very important moment in our organization's history. You know, we're approaching our 110th anniversary serving Southwest Florida, and today is a very significant milestone, not only for the health system, but for the community at large. And we feel very privileged to serve this community. I want to announce today that after a thoughtful and comprehensive national search, I'm very proud to share that the Lee Health Board of Directors has approved Ben Spence as our next President and Chief Executive Officer, effective October 1st, 2026. This decision, yes. This decision followed a very vigorous and highly competitive process conducted in partnership with one of the nation's leading executive search firms. Ultimately, the board selected Ben because of his deep roots with Lee Health, his proven leadership and operational expertise, his commitment to safe, high-quality, compassionate care, and a clear vision for the future of health care in our region. For more than 31 years, Ben has been part of Lee Health's journey, helping shape who we are today and positioning us for where we are going. I want to personally share my full support for this decision. Ben is a respected and accomplished leader. I have tremendous confidence in his ability to lead Lee Health forward, ensuring we continue to deliver the exceptional care our patients, families, and communities expect and deserve. I've worked with Ben for over 19 years in my journey here as a leader, and I can tell you that he brings the right balance of experience, stability, and forward-looking leadership to guide Lee Health into the next chapter. Between now and my retirement on September 30th, I look forward to working closely with Ben and our entire leadership team to ensure a smooth and seamless transition. So at this time, I'd like to introduce Mike Wukich, our Chief People Officer and member of the Selection Committee, to share more about the search process and the selection. Mike?
Great. Thank you, Dr. Antonucci. It's been an honor to serve on the CEO Selection Committee, such an important process for Lee Health. The board initiated a nationwide search working closely with international firm Heidrick & Struggles to identify top healthcare leadership talent. Our selection committee included physician representation, community stakeholders, and organizational leaders alongside our board of directors. Together, we reviewed more than a dozen highly qualified candidates from across the United States. Through a thoughtful and structured process, we reviewed the qualifications and experience of each candidate, and Ben Spence consistently stood out. He demonstrated a deep understanding of Lee Health's mission, culture, and operations. He brings exceptional leadership capabilities, and his forward-thinking vision for meeting the evolving healthcare needs of our growing community made him a top applicant. Equally important, Ben has built trusted relationships throughout the organization over the course of his career, championing both people and performance. The committee and board are confident that Ben is the right leader to guide Lee Health into the next chapter. It's now my privilege to introduce Lee Health's future President and CEO, Ben Spence.
Thank you, Mike, and thank you, Dr. Antonucci. I am deeply honored and grateful for the confidence that this board has placed in me. I'm incredibly grateful to Board Chair Joe Caddy, the Search and the Selection Committee, and especially the medical staff leadership and the donors that rallied behind my selection. Having the full support of our clinicians is especially meaningful to me, as our physicians are the heart and the soul of Lee Health. Lee Health is more than an organization to me. It has been my professional home for the last 3 decades, as I started my career here in 1995 as a reimbursement clerk in the Financial Services Department. And throughout my career, I've had the privilege of working alongside incredible teams across finance, operations, and leadership. This health system and this community have helped shape who I am as a leader. I want to thank Dr. Antonucci and his leadership for his leadership and his mentorship. Under his guidance, Lee Health has grown stronger, more innovative, and more deeply connected to our community. Looking ahead, my priorities are clear and will always be centered on the patients and focus on achieving our great mission of being your trusted partner, empowering you to live your healthiest life possible. consistently delivering high quality, safe, and compassionate care that leads to the very best health outcomes, listening and engaging with employees, physicians, and leaders across the organization and throughout the community, building a destination of care that attracts the best and the brightest physicians and care teams, supporting our workforce and building on our exceptional, empowering, values-driven culture of respect, excellence, compassion, and education, addressing the healthcare needs of our rapidly growing region by making care easier to access, expanding our footprint physically, virtually, and with in-home services, and advancing our commitment to be the healthcare provider and employer of choice in Southwest Florida. I will officially assume the role of CEO on October 1st, and right now I remain fully committed to my current position as Chief Operating Officer, and will be working closely with Dr. Antonucci and our leadership team to ensure a seamless transition. Together, we will continue building on Lee Health's strong foundation and advancing care for the communities we serve. Thank you.
All right, thank you, Ben. So we're very excited about the future of Lee Health, and we're very confident of the leadership ahead. We'll be happy to answer any questions that you might have. Anybody have any questions? Liz?
Dr. Antonucci, when you announced your retirement in December, then how soon afterwards did you decide, I'm going to throw my name in that?
It was right away. It was right away. I felt led in this direction, and I had the encouragement and support of so many that helped build my confidence that this was the right move. And with the board's vote, it confirmed this was God's will for my life and what I want to do with the rest of my career.
Working here for the past 30 years, how did it feel when you got the news that you were going to become the next CEO?
Overwhelming, yeah. I was incredibly grateful and just honored and humbled, starting as a clerk and working in essentially every role through the financial services structure, and then going on to be the CFO for the last 12 years, and then COO. It's been such an incredible journey, and I can't express how grateful I am to Larry, to Jim Nathan before him, who laid this unbelievable foundation and just perfectly positioned us for the future, and I'm ready to lead it forward.
Hi.
What was it about the role that made you want to put your name for it?
Yeah.
Why was this the right
Yeah.
time, both for you and for the system?
Yeah, a great question. It's all about the mission to me. It wasn't about the role. It's more about the goal of wanting to make a difference. And I believe in this organization. I believe in the culture that we've created, and I want to protect that culture. I want to make sure that the culture that Larry's worked so hard to create, and Jim before him, that we're going to continue to be an organization that cares deeply and connects with its community in a meaningful way. And I think I can do that. And I also believe that it's important to have a strong relationship with your board and with the community, and I have those, and I feel that I can best lead forward in developing those relationships with external stakeholders, with donors, and the community.
What are the first things you're going to do once you become CEO? What's the first thing on the ballot?
The first thing is listening. You know, I need to spend a lot of time in a new role listening from a different perspective. I've listened from a number of angles, but I need to now sit back as the chief executive, knowing that I'm responsible now for the strategic direction of the organization going forward, and listening really good to all of our team members, to our board, to our community, to make sure the next steps that we do make are meaningful and what the community wants and needs. But we'll continue. We have a strong plan today that we've helped build, and we're not slowing down. It's not time to stand still. We're going to be moving forward aggressively with our expansion plans and with creating a great workforce and recruiting and retaining the best and the brightest from all over the country.
So now you have a couple more months to go as CEO, but when is the announcement going to be who's going to take place
When is the announcement?
for the next CEO?
Oh, for COO. Well, we're going to be reviewing options from internal to external and reviewing with our team to see what makes the most sense. So this will be a time over the next probably 30 to 60 days to look at the structure. How are we going to, what's going to be the next step in evolving our org structure? And we'll make final decisions probably within 30 to 60 days.
What do you do with your free time there, Doc?
Yeah, I'm not sure yet. You know, there's been two philosophies. People have told me that when you retire, you need to have a plan and make sure you know exactly what you're doing. And then others have told me, well, you know, just kind of let it come to you. And I'm going to be doing the latter. I've been on a treadmill for 50+ years, so I'm going to kind of take it slow, see what comes my way. I will be working with Florida Gulf Coast University. I am chairman of the board of trustees there, so I'm sure that'll keep me busy. And whatever else comes along, I'll just play it by ear.
Mike, what was you had external candidates and you had obviously strong internal candidates. What tipped it toward Ben, toward going with a long-time, very knowledgeable internal candidate?
Well, I'll pass that to Mike because you were actually on the committee.
I think a couple of things. A track record of success. The role that Ben has played as CFO and COO clearly showed that that his ability to lead us forward is there, and he was also part of the creation of our strategic plan. So he's very aware of what we're doing and where we're going. I think that was an important part. And the other piece is relationships, understanding this community, our unique needs, and how those needs align with changes in healthcare overall, nationally, locally, et cetera. So I think between those two things, his track record, and track record, the relationships, and also he's a wonderful person. He's a real person, and very sincere, very humble, very focused on his family and other relationships. You just add all those pieces up, and a tremendous ethical and moral North Star, I think, was another thing that really set him apart.
Any more questions?
All right, well, thank you very much for
Thank you
being
so
here.
much.
Appreciate it. The future is bright for Lee Health, and we're very excited about what this means for our entire community. Thank you.
Thank you all.
Thank you.
Appreciate it.